Okay, can you please state your name and your profession?
My name is Karina Solar, and I'm a registered nurse.
Alright, so I have a couple of questions for you. My first is there a difference between the words health, illness or sickness, and disease?
I feel that there is a difference. Illness, I think, is a state of poor health, and illness is considered, illness can sometimes, I guess, be considered a synonym for disease, but yes, there is a difference, maybe in the type of levels or state of mind or how the degree of.
So is a disease worse than an illness?
Yes, I think for disease, I would think like something pathological. There's something that is it stems from something concrete, and it develops, or it's more complex.
Okay.
Versus illness can be a state of how you're feeling, if you're just sick mentally, or it can lead to something concrete.
Okay, now you said mentally, so may I ask, would you say depression or schizophrenia a disease or an illness?
I would think that would be more considered as an illness because it's a state of your health.
Okay. So should we, and as healthcare professionals, should we differentiate between an illness and a disease?
Most definitely. I think that there is a difference between it. So yes, you definitely should differentiate.
Okay. Totally changing paths here. There's a new concept of personal medical records where people can access their records from home and change them and edit them, or just read them. What is your opinion on personal medical records?
I think people should have access to their personal medical records. As in editing them, I don't think they should have access to editing them. But if it came from a professional or a place where it was a legitimate place of where their medical records came from, well, yes, they should have access to be able to read about it. I think you should be able to know stuff about yourself.
Okay, do you think they should be able to read the notes that providers and nurses write?
I think more the medical records of their lab results, or what their results for their
X-rays.
X-rays, correct. But the notes, I think, should be kept within the within the professional
scheme,
correct.
Okay, but not in the personal medical record.
Correct.
Okay, and do you think having access to a personal medical record where a patient could see, just the lab values, their diseases, which are down, their allergies, etc.
Yes.
Do you think that could improve healthcare?
I would like to think that if someone knew the things that were wrong, or the levels, if their blood levels were off, and they can do something to better themselves, then yes. They can make
lifestyle changes.
Correct. I think that knowledge for themselves, for them to know it and to have it, to have access to that,
right,
can help them.
And then when patients are traveling or changing doctors or coordinating care, they could bring this personal medical record with them. Do you think that would help?
Oh, most definitely, because then wherever they're at, if those medical records that the patient has are legitimate and it comes from a place that's an official place, and they bring it to another country, then yes, I think that knowing, as long as it's within a professional
as long as it's a true medical record and not
correct.
Something that's handwritten,
yes.
changed,
correct.
or edited.
Yes.
Okay, perfect. Thank you so much.